Hi, I'm Sara McDonald, head of Ask Sam. Today I'm going to run you through a full demo of all the features that Ask Sam provides in its Copilot. So I'm going to take you through the scribe feature, the virtual assistant, how to navigate around Ask Sam with all the patient files, and I'm going to show you how to use it. So to start with, we're going to go into the home page. So when you first log in to Ask Sam, you'll be taken to your home page. If you have patients there already, you'll see them here listed up here. So I'm going to open up my test patient here, who is Bilbo Baggins. So I'm going to open this patient up, and you'll see here that his information is going to populate. So if I go down here, you'll see all this information here for Bilbo. There's different categories for his patient history, and I'm going to go through and explain how all that populates. But firstly, let's start with creating your first note. So the first time you log in, you'll want to create a patient note for your patient. So you go up here to generate note via voice document and click that button, and you'll see a box come up here. Now you can do one of two things here. You can either just talk to Ask Sam and you can give a summary of what's happened in the consult. You can press record and record the entire consult with your patient, and Ask Sam will actually record the entire consult word for word, and then you can send it to transcription, which means Sam will just pull the relevant medical information and put it into the patient history. The other thing you can do from here is you can upload documents. So you can actually upload images, you can upload referral letters, you can upload radiology reports, and Sam will transcribe those as well for you. So you simply just go here to upload and you select a file that you want to upload. And once you've done that, you can just add that, and then Sam will transcribe that for you. So Sam's able to transcribe some basic things like x-rays and interpret those, and other more complex things like MRIs. Sam will give you a general idea that it is an MRI, the type of MRI it's given, but he cannot diagnose. So once we've done this, let's go back to, I'm gonna get this out here. But what I do want to do is just show you a quick example of what I'd want to do here if I wanted to actually just type something, or if I wanted to start recording something. So I go down here to the microphone, and as an example, patient came in today and notified us that they had started on warfarin. We'll need to notify their regular GP, and we'll need to do further INR studies. So you can see there I've just recorded that. Now Sam will take that information as I've recorded it, and he will put that information in there. If that's something, if I'm happy with what Sam has done, I can send that to transcription, and then that will go to the patient's history and update the patient's file. So you can see here that's come up there beautifully, and I will just press send to transcription. I won't do for this patient because I don't want it to update their history. I'm going to take you through their history in a moment. Okay, but if you're sitting there with the patient, you can just press record, and you can record the entire consult with the patient. Okay, so I'm going to get out of this now, and I'm just going to show you. So once you've sent it to transcription, the patient's file will populate, as you can see here. Now Sam automatically generates the chief complaint, so you don't have to actually type anything. All you have to do is press the record button. You discuss with the patient, you have the consult, and then Sam will put all that information for you. So you can see here in this one, the chief complaint, Sam has put all that information in there. As I go down, he's put a category there for history of presenting illness. I've got the session summary here, so this will actually just give me a summary of that session. So if I want to send a letter to their GP and I want the session summary there, I can just ask Sam to include the session summary. Sam will put the advice that we've given the patient, and also the future treatment plan and what we plan to do. If you come up back to the top, you can go to clinical examination. So if you did any clinical examination during the session, that will come up here as well, as long as it was recorded. For this particular patient, I uploaded some MRI results recently. So you can see here in imaging and radiological diagnostics, it's come up here. And you can see here as well in the biochemical diagnostics. So I uploaded some blood test results for this patient, and Sam has beautifully broken it down into the different dates. So you can see here there are 2 different dates for this patient, and it's actually broken up every single biochemical result. So if you want to include that into a letter or a summary to another doctor, you can, without actually having to worry about manually putting it in. For this particular patient, he had history of chest pain, so Sam has put that in the cardiological diagnostics. And then in neurological diagnostics, again, Sam will break that down there. And then if we go back up here to the follow-up note, we have the treatment adherence. So Sam will monitor the treatment adherence, the treatment plan progress. And as we go down further, there's also assessment summary. So if the patient has taken an assessment. And then in the case history over here, if we come down further, the clinical history is here. So if you want to send a letter which has the full clinical history, you can do that. Any history of self-harm, aggression, history of trauma, any infectious diseases. Sam will put the medication history automatically in here for you, hospitalization history, surgical history, histopathological, and for this patient, nutritional history, which Sam has filled in for us, substance dependence history. So you can see here too, given with this particular patient, Sam picked up on the fact that this patient consumed half a bottle of red wine a day and has included it in potential substance dependence, which is quite clever. Family history, again, Sam has put that in the family history, the social history. So he's included any relevant social history there. And so you can see how Sam will populate all that information. So what I want to show you now is the really cool feature of Sam. I mean, that's already really cool, but so I want to go up here. So when you go into the assistant, you'll see there's a few tabs up here. So with the medications, depending on what diagnoses have been entered into Sam, Sam will come up with other potential medications that you might want to consider based on the patient's diagnoses. So for example, it's put in aspirin here, given that the patient had a history of heart attack, quetiapine, given the issues with sleep, pregabalin, given the issues with pain, propranolol. Now it's up to you as the clinician whether you include those or not, but Sam will give those as potential ones to use. And then the diagnostics, if we go over here, based on the information Sam's been given, he'll also include other potential diagnoses that we may not have thought about. Sam won't diagnose, but he will include them as potential diagnoses if you consider them relevant for the patient. Now, for the best part of Ask Sam. So if we actually go to the Ask Sam virtual assistant, so at this point you have all the patient's history, which has all been organized into its different categories. So let's just say at this point you wanted to start your patient on a particular medication, but you're concerned about potential drug interactions. So rather than you having to look up to date or MIMS or the Merck manual or anything like that, you can simply just Ask Sam. Okay, so for this patient, I'm going to assume that we want to start them on, say, fluoxetine. Okay, so Sam, I'm going to start this patient on fluoxetine. Are there any particular drug-to-drug interactions or contraindications I should be aware of? So I'm going to ask Sam this question. Now, Sam will actually go and search all the relevant medical literature, all the pharmacological literature, any potential drug interactions, but Sam is going to make that he's going to make that relevant to this patient, Bilbo Baggins. Okay, so you can see here, in relation to the patient's current medication, patient is currently taking telmisartan. Fluoxetine is a CYP2D6 inhibitor, which may increase the levels of telmisartan, which we know the patient's on. And again, more concerning interaction, potential for fluoxetine, increased risk of bleeding with aspirin. And again, also noting fluoxetine may increase the levels of amlodipine. So you can see how Sam's actually given us all the relevant issues related to this patient, not just general drug-to-drug interactions, but those that are relevant for this patient based on the medications that they're on, which means that you don't need to go searching multiple journals and multiple manuals to find that for you. Let's say that I want to write a letter now back to the patient's GP or to a specialist, but let's just use a GP for this purpose. So notice I haven't typed anything yet. My hands are free. Sam, can you write me a referral letter back to this patient's GP, include the session summary, the medications, the treatment advice, the future treatment plan, Okay, so I've asked Sam to do that now. So again, Sam will take that information and he will collect that data from the patient. So once I've transcribed that information, I'm going to send that off to Sam. So just give me a moment while he's thinking about that. There we are. So Sam's going to come up with a referral letter, and see here up the top, we've got the Dear GP's name. So you just put the GP's name in. Referral of Mr. Bilbo Baggins. I'm writing to provide a summary of Bilbo Baggins' recent consultation with me. Sam has included the medications as I asked. He's included the treatment advice as I've asked. He included the future treatment plan as I asked. And you can see here at the end, please do not hesitate to contact me. And then all you have to do is there's a copy button down the bottom, so you can just copy and paste that and put that into your own document, and whether you download it, email it, print it out for the patient, that's done. So that's an example of doing a really quick referral letter. So that took all of probably 30 seconds to do. And notice I didn't have to type anything. Okay, so Sam's done that. Now let's say that I actually want to give this patient a treatment plan for something. And in this particular case, I might want to give him an exercise regime for his back pain. So again, I can ask Sam. Sam, can you provide me with a comprehensive exercise regime for this patient that will assist his low back pain and his rehabilitation? Okay, so I've asked Sam that question. Again, Sam will also go search the latest evidence base for what is the best exercise for this particular patient with this particular issue. So again, I'm going to send that off to Sam and wait for Sam to come back with some information. Here we go. So you can see here Sam's done a beautiful treatment plan for me. So to develop a comprehensive exercise regime, I'll consider his medical history, current symptoms, and the results of his previous diagnostic tests. So he's given us an acute phase, gentle stretching exercises, the subacute phase, strengthening exercises, and then maintenance phase, and then additional recommendations. So again, maintain healthy weight, avoid heavy lifting. Now again, you can just copy and paste this and you can print this straight out for your patient. So rather than you having to sit there and put together a treatment plan, Sam does it for you in a few seconds. Now, the other thing you can do with Sam, because Sam knows all the guidelines, all the RACGP guidelines, the psychiatry guidelines, the physician guidelines. So if I want to know the guidelines, for example, for treating, let's just say I want to know what the guidelines are for treating anxiety, I can just ask Sam. Sam, what are the RACGP guidelines for treating anxiety in an acute setting? Okay, so I asked Sam that question, and again, Sam will go search the RACGP guidelines and he will come back with an answer. And so once he's actually taken that information, I send that off to Sam. Okay, and you'll see what will come up here. Here we go. Okay, so the RACGP guidelines, so assessment, initial management, pharmacological treatment, non-pharmacological treatment. So you have initial assessment, pharmacological, non-pharmacological, and then referral. And the RACGP guidelines also recommends that GP consider the medical history, current symptoms, and the impact of daily functioning. So I might want to find out the next question. Sam, what's the first line treatment for anxiety according to the RACGP? So if I want to find out what medication that would be advised by the RACGP, I can ask Sam that question as well. So again, rather than me having to go and search and look up and spend time doing that, it's literally like, here we go. So you can see here as well, so first line treatment for anxiety is a stepped care approach. Okay, and they actually suggest starting with non-pharmacological interventions, okay? But when you do need to, SSRIs such as fluoxetine may be considered. But it will also bring this back to the patient as well. So notice I asked what the first line approach was, but it also brings it back to my patient and says, in the case of this patient, I had previously discussed the potential of fluoxetine with you and considered potential drug-to-drug interactions. So Sam's very smart. So even though you might ask different questions, Sam is going to, he remembers what you talk about and he'll sort of always pull you back in line. So even though I might want to start this patient on fluoxetine, Sam has told me multiple times now, may not be the best idea. Okay, so I think that's a great use of Sam. And so Sam's like that little literally that little voice that's telling you, not a good idea to do that, or yes, you can proceed with that. So that's the beauty of using the virtual assistant. Now, the other thing that you can use too Once you start to submit quite a few notes for patients, you will actually develop what we call a neural graph. So Sam actually puts all these things together, and you can see here as I click on these, it's going to open up different medications. And so here I've got aspirin. Now with this, you can click on any one of these nodes and the information for those nodes will actually come up. So if I click on, say for example, this one here, ondansetron, if I click up here, you can see it gives me all the information about ondansetron that I will have to know, dosage, potential contraindications, all those kinds of things. So it's literally like having a medical encyclopedia at your fingertips here. But so the graph will just put everything together in a timeline for you. So for those that like more visual things, you can use this. And you can also just use a virtual assistant for anything else that you want. Now, the other thing, if you prefer to have templates that are already done for you, we have actually put together a series of letter templates. So you just can click on that. You can select the type of letter template. So we've got a few here. So there's referral letters, reply letter for GP. We have legal letters and a general letter template if you want to change it to whatever you want. So let's just say we do a summary of patient treatment. You would fill in all this information here with your details and your clinic details. So if you want a letter with your clinic logo and your picture, you would put it up here. Once we've selected that, we go to next. The patient's name there, and you will just confirm the patient's date of birth. And then over here, I can choose what parts of the patient history I want included in the letter. So I'm going to click those there. And here we go. Now I've got the letter here. So I've got my logo, which would be up here if I added it. And then I've got the letter body here, including all the things that I wanted. And then once you've done that, you can go up the top and you can simply download as a PDF. So you have the option to either use the pre-organized letter templates, or you can use the templates with the virtual assistant with Ask Sam. Completely up to you and whatever you prefer to do. Now, if you've got your own software that, like for example, Best Practice or MediRecords that you're using at the moment, what we've also organized to make it super easy for you to transfer this information to that, you simply just go to download PDF of the patient information. This will give you a complete PDF of all the patient information in one part. So all you have to do then is say you just want to include the session summary, the advice and the plan, you can just copy and paste that and put that into your software. And depending on what else you want to put in, you might want to put in the imaging and radiological diagnostics, but everything is there. So all that is available for you. You don't have to go through and copy and paste each individual category there. Okay, so that makes things super easy for you. That's pretty much a summary of how to use Ask Sam and what's involved and what Sam can actually do for you. There's lots of things you can ask Sam with the virtual assistant. He's a great ally to have. He'll pull you up if there are things that you are asking him that may potentially cause some issues for the patient. He'll write you your letters. He'll bring up treatment guidelines. He'll give you any research you ask him for. But Sam can be your best assistant when you're in clinic. So whether you're a doctor, a dietitian, a naturopath, a psychologist, Sam is there to help you and be your virtual assistant. So I hope you all enjoy using Sam. It is free to download. It takes 30 seconds to set up. And you will have a great time using Sam. And we are always here and happy to help and answer any questions. Thank you so much for your time today. I'm Dr. Sara, head of Ask Sam, and I hope you enjoy this demonstration.